On this episode of Africa Health Check,
I should eat the right foods, take less of starch, do exercise.
Jinsi ninavyozingatia afya yangu ni asubuhi nafanya mazoezi, ninakula matunda.
We explore the continent's state of wellness and fitness as we highlight the wide range of factors that influence health outcomes and well-being. Fitness and wellness have become such a huge industry, with many people now making a living from promoting healthy lifestyles, taking fitness from physical engagements to virtual trainings, and almost every other day there's a new product or commodity that is being launched that is aimed at encouraging healthier habits. Africa, are we part of this growing market, and where is our position? Let's dive into this on today's episode as we will be discussing fitness and wellness. I am your host, and I welcome you to Africa Health Check. I'm joined by our experts, Dr. Marianne Mureithi, the chair of the Department of Medical Microbiology and Immunology and a senior research fellow at the University of Nairobi in Kenya, as well as Reverend Anthony Achampong, who's a pharmacist and a pastor from Ghana. But before we hear from them, let us have a look at this episode's feature story.
I am Fikunla Orafidia. I'm a medical doctor and I live in Lagos State, Nigeria. As a medical doctor, you get to experience some of the challenges in the healthcare system firsthand. And you're by default you're pushed to try to solve these problems. So that's what made me start this journey about 8 years ago. With several challenges I faced directly and others that I know about faced. And it's been quite interesting. Filled with ups and downs, but we're pushing it. The first product we started with was a telemedicine product. It was called iDoctor Nigeria. It was basically trying to replicate a hospital online, right? It was to solve the problem of accessibility, and lack of information, on how to manage certain conditions, right? So we were able to partner with a lot of diagnostic centers with chains around the country and school retailers around the country, to ensure that people get their medications on time, they get the right consultation, and they can have the right diagnosis before treating. From our telemedicine product, we're able to help a lot of people, that have been battling illnesses and be self-medicating. We're able to get them access to a doctor, and of course, they were cured of what they were having at the point. We've been able to move a lot of pregnant women who were in labor to the hospital. We've been able to attend to a lot of people at home. We needed oxygen, we needed a lot of intervention and save lives, and we have professional athletes and even amateurs and just people playing sports, recreationally, sustaining injuries, some of them fatal, and not having the right intervention provided for them on the spot, right? So that led to the creation of Sports Assist, right, which aims to improve health outcomes basically in recreational professional athletes, and also to boost the performance, of people that want to go pro. So one of the products we built in Ambulance Nigeria is a power bike response unit. People that have high blood pressure, high blood sugar, for instance, where it's easier to deploy the power bike to them to even test them at home, right? So it's easier for us to do all these tests and monitor them, right? So I believe, and again, you can easily get to remote areas with bikes, so I believe that with this and other innovative solutions that we all would come up with, I believe that we'll be able to meet Africa's needs. COVID-19 taught me to be very flexible, right? There are a lot of things, you can't be rigid, in your practice. You need to be able to bend with what's going on and give your patient the best care. And it also taught me that you need to be prepared. Right, you need to, anything can happen at any time. This is healthcare, this is life we're talking about. So preparedness is important, and also just like every other field, if you want to solve a problem, you need to first identify the problem, right? Make sure you have a problem you want to solve, and of course, start small. Well, my vision for the future of healthcare in the continent is having one where people have easy access to healthcare, appropriate healthcare in this case, and just a healthy population, basically. Affordable healthcare, right information, people educated on the right things to do, and just a healthy population, basically.
Really, really interesting stuff. And I think it ties into the discussions that we've had previously around the issue of public education, raising awareness of the importance of healthy living, adopting healthy lifestyle, and that's actually the current buzzword. If you look anywhere in the media, health, fitness, healthy habits. What is the current state of health, wellness, fitness in Africa generally, Dr. Marianne?
Well, I know we could do better, but I want to start from our history. Before technology ever came in, cars and we'd find our grandmothers, our mothers would walk for distances to school, or to the dispensary, or to the city centers, and they were quite fit. I remember my grandmother would walk for miles just to get to her shopping center. That was nothing for her. Come in cars, come in now easy public transport. For instance, I'll enter my car, reach the office, sit on my desk, do whatever I have to do, go back to my car, go home. And when I realized, I'm not very fit, I then really changed my lifestyle. I really wanted to match my grandmother's longevity and her fitness to her old age. So I myself personally, I gym every morning and evening. I also do some exercises as well. I could call myself maybe a fitness freak after I realized my lifestyle may not be very good for my heart and also my brain. And I can say since I made this transformation for my own wellness, I'm very chirpy, if I can say that, very happy. The endorphins, you should see me in the morning, I'm just buzzing from the gym to the workplace. And I hope that people around me can also see the changes. My family, we are quite, we like fitness because, again, we've watched our fathers, our grandparents being very fit. So again, it starts with you, starts with your family. It's good to keep fit and healthy. You keep away some of those infections. You keep away lifestyle diseases. Remember hypertension, diabetes and all. And you remember during the COVID-19 pandemic, those were the people who are worst hit, anyone living with a comorbidity. And how to keep them away for a long time is to keep well, keep healthy, keep strong, and lift those weights if you have to. There's data that shows you actually live longer. So let's keep fit, let's keep healthy.
Yes, absolutely. It's very interesting that you're talking about history, and that's actually what was on my mind as I was preparing for this episode, that, historically as Africans, fitness should have never been an issue. We're always about walking from one end to another, engaging in a lot of physical activities. Like, we are always physically engaged. I mean, go to a typical African wedding or funeral or any event, you are dancing, but even just, the labor-intensive work that forces you to really apply your body and exercise, but these days you find that our kids, the way they play is with the gadgets. They don't even go outside anymore. Where did we drop the ball?
Well, our mothers and our grandparents, whatever they did was involuntary. They walk distances to the farm and work physically. After that, they carry loads and walk back home. When they come out, they go to the riverside, fetch water. It's all activity. It's all work. And science has proven that if a person will commit to physical activities, that you impact your whole body chemistry for well-being and well-doing. And that is what, that is the mismatch between their generation and our generation. And at worst, many people think that fitness, exercises, has to do with weight loss. That is all about it. And that is a huge mistake. It's not weight loss. Science has proven that it impacts your brain function, your heart health. So many that so many it impacts your complete body, and that is what we're. So if you want, we're talking about health for Africa, health for everyone. There is no way we can leave fitness out of the equation.
Absolutely. So the data is there, the information is there, the research, the evidence. We are all aware of the importance of living a healthy lifestyle, wellness and fitness, but still we are not being compliant. Still, we are not exercising. We're not being very deliberate and intentional about adopting healthy habits. Why is that, Dr. Marianne?
Well, I'd think probably technology. It has worked both ways. It's good. It's made our lives much easier, but it's also made our lifetime or life outcomes much worse. I will sit in the car. I'm already in the office. I'm not working. I will sit at home with the TV on the whole evening, with my legs raised up, and then go to bed and do it again and again. Technology. So we have to be very deliberate. Look at our children now. We have, instead of playing outside and being innovative, climbing trees and bikes, they are on their gadgets, PlayStations, you know, and it's something we need to be quite deliberate about. And again, I go back to my common theme, awareness. Are people aware of actually just that 30 minutes walk? You don't even have to run. Just walk down the road and back. Is so beneficial for your bones, your heart, every being
your
in
mental health as well.
Exactly, your mental health. Are people aware of that? Are there campaigns to make people out of their seats and out there on the streets walking or doing something? So we need to, first of all, create awareness, the benefits, show graphs. I saw data from Japan. Japan, actually, someone who's 80 and they're dying at 80, they said, oh, that person died very young. You know,
that's true.
They live to their hundreds.
For many Asian countries.
That's a very young person. And what I've read through what they do, they eat very well. They eat their fish.
They walk as well.
In Italy as well, they walk. So we need to also spread that awareness. Guys, let's walk.
And maybe perhaps there's also cultural factors and what as society, you know, we associate with healthy living, healthy lifestyle. Because one thing I know that's a bit toxic about our African society or community is that we associate, you know, being obese with being successful. You know, there's even that joke. I don't know if it's there in Ghana or in Kenya, but I know in my country, we always say that, you know, you start making money once you have a pot belly. You know, where exactly, you know, whereas
an interesting take. I just got married, and my husband and I got married many years ago now, and we started the exercise regime together, and he started losing weight, looking fit. My mother-in-law had to call me for a meeting. Is everything okay?
You're not feeding him.
Is he eating? Because again, that generation and many of us associate adding weight, the pot belly,
with happiness, success.
So,
and isn't it interesting that when you go to Europe, it's actually the opposite. Wealth is associated with you being fit, you know, not being obese, not being overweight, because it's assumed that you actually can afford healthy eating, which is also pricey. You can afford to go to the gym and, you know, have all of those healthy regimes. But I know that it's still deeply entrenched in our culture that, you know, pot belly is a sign that
he's wealthy,
very rich, you know. So I think those are some of the habits that are perhaps being passed down to our children. We're talking about raising public awareness or public education, even in the feature story. There's an increasing huge market about healthy eating, healthy habits, so much that it actually scares me, because these days everything is written organic, you know. So how do you also get to discern to say these are the habits or these are the commodities that I will absorb with my family, and then choosing, you know, the good ones from the bad ones? Because there's so much going on. There's so much advice out there, you know, so many things for sale and so many influencers saying so many things about being healthy and fitness. Reverend.
Yes, what I want to, you know, I want to respond to the gentleman's or the doctor's feature story. It sounds commercial.
Yes.
And a lot of people are into the trade, but if fitness has to be reduced to a gym, the whole point is defeated, because one doesn't have to go to a gym to exercise, to live fit. There are so many ways, and that is where I do believe, like Dr. Mariama said, awareness, education. What can one do minimally in order to get a fit? In this one, in the space of this room, you can exercise. You don't even have to go outside of your house.
Or have a trainer to do that.
You don't need a trainer. There are certain routines that you can do in order to keep yourself fit. Skipping, jumping, swimming, even daily activity, making sure that, but most importantly, if you live in a big you can just walk. Moderately intensive for 30 minutes a day, 150 minutes a week. If you can keep the rhythm, you'll be in great shape. Absolutely. But the idea that I have to go to a gym, pay an amount of money to somebody. Here is an old lady or a young man, a very busy person, tired. Where is the gym? It's the next 2 blocks or 2 miles away. It's quite defeatist.
That's true. I mean, similarly to how, we think healthy eating means getting avocados, and people are saying, avocado is expensive, I can't afford it, so I can't afford eating healthy. But clearly, there are many alternatives that have always been part of our even African delicacies that are actually really, really healthy. When you come back from the break, I want us to talk about some of the most successful interventions that you know of that promoted fitness and wellness in different countries, or maybe in communities that you have worked with. But for now, we are going for a quick break where we hear what people on the streets of Africa had to say. Stay tuned.
When it comes to social economic impact and psychological impact of the pandemic, especially COVID, I think it left a huge impact in Africa. Personally, I lost a number of friends and also relatives.
Kama youths, we are flexible. Tunaweza access kila mahali, maybe internet. Tuko flexible, tunaweza tembea kama uko mashinani kueleza watu they should go to the hospital. I think even though when youth wanaweza kuwa involved na kupeana awareness.
Sehemu sasa di vaccine serase hakiki tota gore ke ka isimolla ke re ngwa tsanga ya tshwara ka gore nne bokutshana ka lebaka la gore ekare ga gona a ntira nkare ga gona boeteledi pele bo gatellang thata gore bo maleba o tata bo bona mo tlhokometse gore dilo tse ka nako tse ke nna ntse le malala o tsweretse ke sone se mo se ka go ebela ka dinago se gore ba ntse ba le teng ka dinako tsotlhe.
Welcome back to Africa Health Check. We are talking about wellness and fitness in Africa. We've been talking about a bit of a negative side on what we're not doing, what we could be doing, what we should be doing. But I want us to sort of end it off on a positive note. What are some of the successful interventions that you know of at community level that have been implemented to promote healthy living, fitness lifestyle? Inexpensive initiatives that have been very impactful. Let's start with Dr. Marianne.
Okay, so at a local community levels, apart from increasing awareness, we have practical examples where we have, can I say, like in our example, city marathons or city walks for a public initiative, like having, like now in the next few weeks, we'll be running for children who have heart diseases. It's for the whole of the Nairobi city. We raise some money. So we keep fit, run for your 5, 10, 20 kilometers, but you're doing it for a good cause. I recently participated in a marathon to raise school fees for medical students who can't afford. I think you can see one of my bags, it says, leave no medic behind. And that was one of the initiatives we were racing or running for. So mixing, just keeping fit with a very good initiative. I'm seeing it really reaping benefits, not just for the community we are trying to raise funds for, but for the people participating. So each year we see the numbers raising. If it's for, there's an aerobic heart run, there's diabetes run. So we have all those small initiatives, but it keeps Nairobi people moving. Another initiative to involve a little bit of money, but I think it's been life-changing, is what me and you are wearing. That is a digital smartwatch. And I saw these smartwatches make such a huge difference. Maybe not here, but abroad, where they now have a technology to even measure your oxygen levels, measure also your heart rates. And when I started wearing this, maybe 5-10 years ago, when I started really taking care of my health, is when I realized I don't sleep well. I thought I sleep, but then when I looked and I monitored, it showed me that I only sleep light. I don't go deep. And that's what made me now realize I need to be more active. And that's when I signed up for the gym, started running, and I now sleep much better, because I knew if I don't sleep well, in the long run, I'm going to pay for that in terms of my mental health, in terms of my own physical health. Absolutely, so personally, it's brought a lot of changes in me. I'm able to see, today I've not really walked that much, because I need to walk at least 10,000 steps a day. So I need to make a change. If it means walking around my office or this room, I'll do. So yes, it's a bit expensive, but it's also the benefits, I think, outweighs all that. Absolutely. So there are many ways we can do. For the farmer, that's just that time you spend on the farm, that if you do not know, it's really beneficial to your heart, to your muscles. So in every space that you're in, make sure that at least you're having your heart beat a little bit faster, not because of stress, but because you're doing something within yourself, using the tools you have, the initiatives you have around you to keep fit. And then us in public platforms, social media, yourself in the media out there, please advocate for fitness. Please advocate for activity, especially for our next generation. If you have children, at least create a time frame where between this time and this time, go out, ride your bike, join a local club, but just keep moving. Because again, you don't want to raise children who are obese. Nowadays, I see diabetic kids. That's not fair for that child. Okay? So how do we prevent that? Just keep them active. Keep them active.
Absolutely. And I can attest to what you're saying about the smartwatch or smartphones. I started using a smartwatch, I think, 2 years ago, and it has really helped me keeping fit, because you also feel proud to say, oh gosh, I burned 600 calories, now I want to burn more calories. The reminders to drink water was one thing that was really, really transformative in my life, because I realized that my water intake was actually really, really low. But now every hour, every 2 hours, my phone reminds me, drink water, So it's just those things, that you actually, I think sometimes we live such really busy lives. It's not that we intentionally don't want to engage in fitness activities, but once you have that reminder, that sort of motivation, that sort of push, it absolutely changes everything. Reverend?
I think, yes, what Dr. Miriam is saying, that her change of lifestyle, and love for fitness is informed by research, which she has captured in a watch. How about the other people there? So her commitment to that. That's what we're saying, that let people come to know the benefits
the value,
being active. Sedentary living, physical inactivity destroys a person's health completely. I heard these stories during the COVID time. People that were addicted to gym suddenly are locked down. You can't go anywhere. And they were itching to go to the gym. The gym managers send them some videos, so they could do certain exercises at home. Instead of going to the gym to lift, they improvised other things. So if one knows the value of the exercise, of the fitness, they will find a way to do it.
Absolutely. Where there's a will, there's a way.
She goes out with a husband. You inspire one another. Even if you wouldn't go, you are motivated to go. So it is something that we should see as not a do or die, but something, if you don't do, your health is going down.
Yeah.
God has factored that into our system. The body has to work.
Yeah.
As it works, aeration, hydration, your muscles, it impacts your sexual reproduction. Everything about you is in the fit, apart from the food and other things that you do. So this talk is necessary.
Absolutely.
For the young people that are coming up, and those people that are diabetes, hypertension, and all those things have their answer partly in fitness. And they will do themselves a lot of good by taking the counsel that we are given on this platform.
No, that is really, really important message, Reverend. One thing I appreciate in Botswana, the private sector has gotten into this initiative of building community gyms, so they go into a community or a neighborhood and they put up some gym equipment and it's free for anyone to use, and a lot of people, especially after COVID, interestingly, a lot of communities have started using those gyms after work, early in the morning, and it's just really admirable. So maybe just to conclude, we've been talking a lot about what people can do at an individual, at a personal level. Are there any efforts that can be done at a national level to encourage wellness and fitness?
Yes, it's education. I remember when we were in primary schools and middle schools, they made you go for PE, physical education. We thought it was for fun.
Yes.
We thought it was a break, learn arithmetic and all those. We thought it's for entertainment. But in actual, it was not explained. And the moment you leave elementary school, primary school, middle school, that's it.
That's it, yeah.
You get into secondary school, sixth form, you are studying chemistry, physics. You don't have time, to be going around all this. Why? Because you don't know the value. And there are many graduates, there are many top people who think very little about fitness. And I think somebody has to take the thing and blow it. Your health, your life, your well-being is at risk. If you don't, through discipline, commit to physical activity.
Yes.
Of any shape or any form, skipping, whatever.
Absolutely. Absolutely. Thank you for that. Your parting shot,
I think,
Dr. Mariam.
just to add on to what Reverend is saying, we all have this universal health coverage. I feel we need to also add in that wellness and fitness.
Yes.
Not just physical wellness that we're speaking today, but also mental healthness. Maybe incorporate in our small hospitals, small clinics, a wellness clinic. You're okay, but just go in there, have your blood sugar levels, all these things monitored, put on a machine perhaps just to look at your weight so that again you can make some lifestyle changes, have a counselor there or a psychologist who then can walk you through how is your diet, maybe you're taking too much salt or cholesterol, and then encourage people to walk starting from there at a national level. Let it be a conversation on that table when you're talking about vaccines. Do you have enough vaccines or do you have enough medication? Make sure within each hospital there's a wellness clinic. And then with that, also have it in a curriculum. As you said, PE we did it as fun, but again, we need to see PE growing to be even a career choice. It's something that we need to see more sports medicine or sports experts out there who are not just talking about a particular sport, but are talking about movement. Move this muscle, this muscle. Again, it will see us living longer, and living longer meaning we are living longer without all those comorbidities, so that we are rich. We have the potential to reach 100. Yes, we all have that ability, and through God's grace, and keeping fit is the way to do it. So let's keep walking, Africa.
Let's keep moving.
Let's
Absolutely.
keep moving.
I absolutely love that. And I think one thing that's coming out also strongly is that let's just change our mindset around these things. Let's stop thinking that, doing yoga or meditation is a Western idea, Let's stop associating wealth with pot bellies, but actually celebrate and embrace healthy living, healthy lifestyle, and not even look at it from an expensive point of view, like you're saying, Reverend, walking at home, healthy eating habits. It doesn't have to be meal prep and those fancy things, as long as it's just aligned to making the right choices about what you eat and keeping active as well as much as possible. So I think that's really fantastic, bringing us to the end of this episode. But before we wrap up, let us head over to my home country, Botswana, to highlight our Africa Health champion, Kitumetse Ingrid Makuku. Let's have a look.
On our show today, we look into the inspiring world of Miss Kitumetse Ingrid Makuku, an extraordinary Africa Health champion who is making a significant impact on the wellness industry. With a career spanning over 13 years, Kitumetse has established herself as a registered and qualified dietitian, leaving an indelible mark in both clinical and corporate spheres. She has dedicated herself to promoting healthy living. Her passion for nurturing the health of the younger generation is truly commendable. With practical experience in the food service and academic sectors, she has played a vital role in developing the field of nutrition. She is also an advocate for holistic health and offers weight loss coaching, specializing in weight management programs and child nutrition.
Really inspiring stuff by our champion Kitumetse. Do keep up the great work that you are doing. And that brings us to the end of today's episode. From my awesome Africa Health Check team and I, we give you a big thank you for tuning in. Remember to subscribe, like, share, and leave a comment on all our digital platforms so that you may form part of the stories that we highlight right here. Remember to subscribe, like, share, and leave a comment on all our digital platforms so that you may form part of the stories that we highlight here. Do follow us on Facebook, Twitter, Instagram, LinkedIn, as well as YouTube. The handle is @Africa Health Check, and we look forward to hearing from you. Until we meet again, same time, same place, same date, remember the future is Africa, the future is today.